Hello everyone, Dr. Fink here. Today we'll talk about how anabolic steroids can cause health risks via increasing the production of red blood cells. Again, quick disclaimer, this is not medical advice, this is just entertainment. For those with medical conditions, please consult a physician. So what is the role of red blood cells in our body? Red blood cells carry oxygen. Okay, so if you have more red blood cells, we have more capacity, more aerobic capacity. So we can have longer aerobic capacity. We can long run, for example, we can exercise longer. So that is actually a good thing. But what happens if we have too much red blood cells? If we have too much red blood cells, our blood becomes viscous, and this can lead to cardiovascular problems. So finding the right balance of having the right amounts of red blood cells improving our performance, but being below the threshold where it gets dangerous and our blood becomes too viscous is crucial. We usually say that a hematocrit is basically the percentage of our blood consisting of red blood cells. If it is more than 54%, it can become dangerous. So keeping our hematocrit number below that number is important in order to minimize or prevent those cardiovascular diseases related to increased hematocrit levels. So how do anabolic steroids increase the production of red blood cells? Well, everything starts in the kidneys. Okay, so we draw a kidney here, and on the kidney we have androgen receptors, okay, like so. And testosterone and anabolic steroids are androgens. So now let's say we have testosterone here, and testosterone will go to the androgen receptor and bind. And now this is activated. And this causes the release of EPO, erythropoietin. Okay, erythropoietin is basically going to travel. EPO is a molecule that acts like a hormone, and this EPO, let's make it a triangle, will travel down the bloodstream until it reaches the bone marrow. And in the bone marrow we have EPO receptors, and they will bind to the EPO. And this binding to EPO receptors from the EPO will increase the production of red blood cells. Okay? So again, androgens, testosterone, other anabolic steroids bind to the androgen receptor in the kidney. This will release EPO. EPO will travel to the bone, and in the bone marrow bind to the EPO receptors, and this will cause an increase of red blood cells. So there's different binding affinities, different effects of anabolic steroids on EPO, and with the biggest risk incurred by testosterone. Then we have equipoise or boldenone, and then we have oxymetholone or anadrol. So these are the biggest risk factors for red blood cell increase. Especially combining those can be very dangerous in terms of having really high red blood cells, leading to hematocrit levels above 54% and making the blood very viscous and causing potential cardiovascular diseases. Anadrol, for example, has also been used to treat anemia. So anemia is basically a condition in which patients have too little red blood cells. So imagine if a healthy individual takes anadrol and increases their red blood cell to a level where it gets really dangerous, and especially if they're combined, let's say anadrol and equipoise and testosterone, that would be a very dangerous mix. There's other steroids like anavar, which are less prone to lead to the increase of red blood cells, but these three are very dangerous in those in terms of increasing red blood cells. So in case somebody is using those, it is crucial to monitor your red blood cell count, and if it goes too high, above 54%, it is always good to take actions. So what can you do to reduce your red blood cell levels? The fastest and easiest way is oftentimes to donate blood, and this will usually cause quite some drop in the hematocrit level in the red blood cells, but it has to be done regularly, and it is not a one-time fix. So for those who are using those compounds, please be careful of your red blood cell hematocrit count. Thank you for watching.